For the past 2 decades, obesity has been defined by body mass index, in which a BMI above 30 has been called obesity. People have observed that people with a BMI above 30 have improved cardiovascular outcomes compared to others. However, we all know that obesity is a major cardiovascular risk factor for heart rhythm diseases as well as coronary vascular disease. Hello, everyone. My name is Dr. Sohail Zahid. I'm a cardiology fellow at Johns Hopkins University, and I'm here today to talk about our latest commentary titled, Does the New Clinical Obesity Definition Address the Obesity Paradox in Cardiovascular Health? What this new obesity definition talks about is how to reconcile this obesity paradox with cardiovascular disease. The Mayo Clinic Proceedings has described for the last several years how physical fitness and body shape make a huge distinction in cardiovascular prognosis and cardiovascular health. The Lancet definition now incorporates these metrics into the definition of obesity in order to better define who has negative problems from increased fat mass, whereas who is actually cardiovascularly fit. We provided commentary in the Mayo Clinic Proceedings discussing how this new definition is a major step forward in understanding how obesity plays an important role in cardiovascular health. The old definition of obesity is based on body mass index, and people with a specific body mass index above a certain level, say above 30, are now eligible for certain medicines or procedures in order to reduce their weight as well as to improve their cardiovascular outcomes. However, we all know that some people have problems with increased weight at lower levels of weight, such as having issues such as diabetes or cardiovascular disease at lower levels of BMI. This is especially true in certain populations, such as people from South or East Asian ancestry, people who are older, people who are more frail. And what we recognize is your weight is not an end-all be-all for your overall health. This new definition tries to be holistic in understanding who has problems from excess weight in their body and how we can use that information holistically to understand who can benefit from these new advances in obesity medicines and therapeutics. So what we talked about in this definition is once you start integrating everything together, you no longer have an obesity paradox. Whereas in the old days, if you just rely on a single number, you start having these weird issues going on. So our assessment is when you're assessing someone in terms of their health clinically, don't look at a single number alone, such as their body weight. Look at everything, such as their body weight, their body shape, their fitness, their comorbidities, their overall health status, in order to prioritize treatment, better provide diagnostics, and then better care for the patient afterwards. So our commentary is one of many, but what we're trying to say is instead of focusing on a single number to take care of your patient, try to look at them as a whole person and go from there to better take care. We encourage everyone to take a look at our article, provide commentary, and help us understand ways we can better take care of our patients together.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.